In this video by deck plate, we will understand the VA rating for cholelithiasis, cholangitis, gallbladder injury, gallbladder removal, pancreatitis, pancreas transplant, and post-pancreatectomy syndrome. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Chronic biliary tract disease. Diagnostic code 7314. Chronic biliary tract disease includes conditions such as cholangitis, biliary strictures, sphincter of Oddi dysfunction, bile duct injury, and choledochal cyst. 30% rating. With 3 or more clinically documented attacks of right upper quadrant pain with nausea and vomiting during the past 12 months, or requiring dilatation of biliary tract strictures at least once during the past 12 months. 10% rating. With 1 or 2 clinically documented attacks of right upper quadrant pain with nausea and vomiting in the past 12 months. 0% rating. Asymptomatic, without history of a clinically documented attack of right upper quadrant pain with nausea and vomiting in the past 12 months. Note: rate primary sclerosing cholangitis under chronic liver disease without cirrhosis, diagnostic code 7345. Cholelithiasis, chronic. Diagnostic code 7315. Cholelithiasis refers to the presence of gallstones in the gallbladder. Rate as chronic biliary tract disease. Diagnostic code 7314. Gallbladder injury. Diagnostic code 7317. It refers to the injuries to the gallbladder due to surgery, trauma, disease, or infection. Rate as adhesions of the peritoneum. Diagnostic code 7301. Chronic gallbladder and biliary tract disease. Diagnostic code 7314. Or cholecystectomy complications. Diagnostic code 7318. Depending on the predominant disability. Note: a finding of adhesions is not necessary when rating gallbladder injuries analogous to diagnostic code 7301. Cholecystectomy, gallbladder removal, complications of diagnostic code 7318. With recurrent abdominal pain, postprandial or nocturnal, and chronic diarrhea characterized by 3 or more watery bowel movements per day, rating 30%. With intermittent abdominal pain and diarrhea characterized by 1 to 2 watery bowel movements per day, rating 10%. Asymptomatic, rating 0%. Pancreatitis, chronic. Diagnostic code 7347. Chronic pancreatitis involves long-term inflammation of the pancreas, leading to persistent pain and digestive issues. 100% rating. Daily episodes of abdominal or mid-back pain that require 3 or more hospitalizations per year, and pain management by a physician. And maldigestion and malabsorption requiring dietary restriction and pancreatic enzyme supplementation. 60% rating. 3 or more episodes of abdominal or mid-back pain per year, and at least 1 episode per year requiring hospitalization for management either of complications related to abdominal pain or complications of tube enteral. Feeding. 30% rating. At least 1 episode per year of abdominal or mid-back pain that requires ongoing outpatient medical treatment for pain, digestive problems, or management of related complications, including but not limited to cyst, pseudocyst, intestinal obstruction, or ascites. Note: appropriate diagnostic studies must confirm that abdominal pain in this condition results from pancreatitis. Separately rate endocrine dysfunction resulting in diabetes due to pancreatic insufficiency under diagnostic code 7913. Diabetes mellitus. Pancreas transplant. Diagnostic code 7352. For an indefinite period from the date of hospital admission for transplant surgery. Rating 100%. Minimum rating 30%. Note: assign a rating of 100% as of the date of hospital admission for transplant surgery. 1 year following discharge, determine the appropriate disability rating by mandatory VA examination. Apply the provisions of Section 3.105E to any change in evaluation based upon that or any subsequent examination. post-pancreatectomy syndrome. Diagnostic code 7357. This condition follows total or partial removal of the pancreas, leading to various digestive and metabolic complications. Following total or partial pancreatectomy, evaluate under pancreatitis, chronic diagnostic code 7347. Chronic complications of upper gastrointestinal surgery, diagnostic code 7303. Or based on residuals such as malabsorption intestine, small, resection of. Diagnostic code 7328. Diarrhea irritable bowel syndrome, diagnostic code 7319, or Crohn's disease or undifferentiated form of inflammatory bowel disease. Diagnostic code 7326, or diabetes diagnostic code 7913, whichever provides the highest evaluation. Minimum rating 30%. Thank you for watching this video. Please don't forget to subscribe and like our videos.